Hi friends, so today I'm going to be talking about the varicocele surgery. The important topics that I'm going to cover are: what is varicocele, what are the symptoms of this condition, what are the treatment options available for this condition, how does the recovery look after a surgery or procedure to manage this condition, and what is the cost of the varicocele surgery in India. Important topics to be covered today. Now I'm going to tell you that what is varicocele. Basically, varicocele is collection of blood in the blood vessels of the testes. The blood vessels originate from the abdomen, traverse through the abdomen through the male genitourinary system and go in the base of the testis. This is the downward flow of the blood. After this, the upward flow of the blood is managed by some valves. When these valves become ineffective or are not able to function properly, the blood gets collected at the base of the testis, leading to engorgement and enlargement of the blood vessels at the base of the testis, which becomes a painful condition. This is what is called as varicocele. So now about what are the treatment options for managing the varicocele. There are basically three options. One is the laparoscopic varicocelectomy, second is the microsurgical excision, and third is the embolization of the varicocele. Now what does the laparoscopic varicocelectomy involve? It involves putting a small incision in the abdomen, identifying the abnormal veins, and then dividing them and ligating them so that the abnormal blood flow to the testicular veins stops. The next is the microsurgical varicocelectomy, which involves putting a small incision in the groin, identifying the distended vein, then putting a ligation band across the distended vein so that it stops the abnormal engorgement. And third is the embolization of the varicocele, which basically involves again putting a small incision in the groin, identifying the distended vein, and then putting coils and stents to stop the blood supply to the distended veins. This then reduces in size over time. The distended vein becomes smaller in size and the symptoms go away. So how long does it take to recover after a varicocele surgery? Usually it takes about a week to 3 weeks for most of the symptoms to subside completely. Immediately after the surgery, you will be advised some antibiotics and some anti-inflammatories to control the pain. You are supposed to have some days of bed rest and not do a lot of strenuous exercises. After 3 or 4 weeks, once you have recovered sufficiently, the healing has completed inside and your symptoms have died down, you can then begin with light walking and other exercises that you are generally used to. If you face any problem suddenly in terms of developing an acute heat in the area or developing fever, then you should talk to your doctor and see what next to be done. What is the cost of the varicocele surgery? Usually the cost of this bilateral surgery will range anywhere from $1,400 to $3,000 in India. This will depend on a couple of factors, depending on what procedure is advised for you, who is the surgeon, what is the seniority level and the experience of the surgeon, what is the brand value of the hospital, and finally what room category do you select in. Prices vary according to the room also in India. So you need to factor in all these issues, and then you will know what is the price. I hope you like the information that we have made for you for the varicocele condition and the procedure. Please connect with us if you're looking for this procedure, or share it with somebody who might be in need of this. We will be very happy to guide. Thank you.